beautiful people. Welcome back, everybody. Good morning, good evening, good afternoon, wherever you are in the world watching this video. Welcome. I am Dawn, and this is Dawn's Beautiful People. I'm so thankful to each and every one of you. Okay, my supporters, you don't know how excited I am about this YouTube channel. And I know and I hope and I know that you are learning, you're sharing, we are being open. So today this topic is about hospice, true or false. Okay, now stay tuned, because at the end of the video I have something that I want to share with my supporters. I have some exciting news that I've been working on. Okay, so stay tuned. All right. Yes, so just to kind of let you know a little bit about me, if this is your first video watching, I wear many hats. Okay, this channel is about relationship advice. It's about natural hair. Under this great piece, I have natural hair underneath there. And it's also about hospice care. I am a registered nurse. I've been a hospice nurse since 2012, and I've been a nurse since 2010. Hospice end of life care is something that's really dear to me. I know a lot of people, when they think of end of life care, they get sad and depressed. But my goal is to take away that myth, to take away the taboo when it comes to hospice, okay? I don't want us to be afraid of dying, because it's a natural process, okay? And hospice is a great service. Now, that being said, let's get started, okay? Let's get started on the video. I have 7 things I'd like to talk about, okay? And I usually have my notes. I have 7 topics I want to talk about regarding hospice, true or false, okay? What you have probably heard or have not heard regarding hospice. And I just want to clear the, issue. I just want to clear the table, all right? So that we get the proper information, all right? And please write a comment. Let me know your thoughts of what you think, and let me know your thoughts. That's how we're going to grow. Okay, so the first comment I have, okay, let me know if this is true or false. Let me know what you think. Hospice equals death. Okay, so hospice means you're going to die now. True or false? Is that true or false? Think about it. False. Okay, hospice does not mean you're going to die now. Okay, a lot of people think of, when they think about the word, okay, when a family think of putting their loved ones under hospice care, they say, oh my God, dad is gonna die tonight, or mom is gonna die tonight if I put them under hospice care. And that is absolutely not the case, because research has shown that people live longer, okay, under hospice care. And the reason why they live longer, and why they tend to live longer, is because of all of the added support. You have everybody in the team. I have made a previous video that talks about everybody in the team. You have the nurse, the social worker, the spiritual care coordinator, hospice aides, volunteer, massage therapist, Reiki therapist, on hospice physician, doctor to help. You also will have the nurse to manage your medications. So all of these added support, really help quality of life. It really helps to broaden, extends, and adds to somebody's quality of life. So no, hospice absolutely does not mean you're going to die right away. That is false, okay? So that's the number one thing. When you hear of hospice, it doesn't mean you're going to die tonight, because actually some of our patients, are you aware that some people actually graduate from hospice? Yes, that's true. They get taken off of hospice care, and that's because every 3 months, okay, we as the hospice team, we have to prove to the insurance company that the person still meets criteria. And there's a whole list of things that we have to do to show, to demonstrate that the person meets criteria. And if the person does not meet criteria, we have to take them off of hospice. Yes, you hear me. Some people actually get off hospice. Okay, so when you think about hospice from now on, if you hear somebody say to you, oh, don't put your mom on hospice care, don't put your dad on hospice care, that means they're gonna die right away. That is false. Okay, my people, okay, my Duns beautiful people, I always say the more knowledge we know, the better. More knowledge we have, the better off we are. Okay, all right, so that's number one. Now number two is, okay, once you've gone on to hospice care, you can't change your mind. Is that true or false? Once you've signed onto hospice, can you or can you not change your mind? Yep, the answer is nope. That's not true. You could absolutely change your mind, and it's called revocation. Okay, you could sign a paper that says you choose to revoke your hospice care benefit. So say, for example, say you are a cancer patient, okay, and you decide to go back for more treatment. You decide to go back for more radiation or chemotherapy, more aggressive treatments. So hospice team will have you sign the revocation paper. And what that means is that you're going to be taken off of hospice so that you could go ahead and get the aggressive treatment that you seek. Like I mentioned, whether it's chemotherapy, radiation, okay, so you could go because the insurance will not pay both hospice and aggressive treatment. So you could go seek the treatment, and if you choose in the future to come back onto hospice, you're free to do so. Okay, so once again, it's false. Once you get onto hospice, you could definitely come off of it if you choose to. Okay, so that's number three. So I have 7 things that I just want to briefly talk about. 7 myths, 7 false misconceptions about hospice. All right. So myth number 3. Myth number 3 is you have to be a DNR in order to enter hospice, which is false. Okay, you could be full code and be under hospice care. So DNR means do not resuscitate. Okay, so if somebody is having difficulty, is having a hard time signing the do not resuscitation, that says I do not want CPR. If you're not ready for that, it's okay. You could still come onto hospice and then change your mind later on. All right. Now, the reason why it is preferred you are a DNR in order to be, when you are on hospice care, is so that the hospice nurse will be able to pronounce when the patient pass. So if you are a full code, if you're not DNR and you're under hospice care, when the time comes and you pass, a hospice nurse, we would not be able to pronounce you. We would have to call 911. We would have to call the EMT. We would have to call the police so that they can come into your home and, attempt CPR and then do the pronouncement. Okay, so it just makes everything a lot smoother if you are a DNR, if you are do not resuscitate versus if you are full code. But once again, if you are full code, you could still sign onto hospice, and then the social worker and the nurse will have a conversation with your family, with you, so that you could do the DNR form. Okay, so that's number 3. Number 4 is hospice is a place you go to die. Hospice is a place. Myth. It's not true. Hospice is not a place, okay? Now, that being end of life care, hospice, it's not a specific place. It could be your home residency. It could be at a nursing home. It could be at an assisted living. It could be in a hospital. So it's not a particular place. Now, that being said, there are such a thing as hospice houses, where it's just a building. It's a place where it's only for hospice patients. Okay, that's another service that's available. But for the most part, hospice can be wherever the need is. Okay, if your dad is at home and your dad's wish is to pass surrounding his wonderful children, surrounding his grandchildren, his wife, we could make that happen. We could make and honor that wish to, have dad pass at home, so he's not at a. Dad can be, in peace at his home where he's lived for years and years, surrounded by his loved ones. Okay, or if your mom is at a nursing home, we can definitely cater to her at the nursing home. We can go there, manage her care, help to work together, collaborate with the nursing home staff so that mom can get the optimal care at end of life. Okay, so that's number 4. Okay, hospice is not a place. Hospice is wherever the needs is. All right, number 5 is another myth of hospice, that hospice is too expensive. You might hear somebody say, it's too expensive, I can't afford it. False. Okay, hospice is 100% free. It is covered by Medicare 100%. Okay, and also if you don't have Medicare, it most of private insurances also covers hospice too. All right, you just have to check with your local insurance company. We, the hospice team, will never ask you for a dime. Okay, keep that in mind. We will never ask you for a dime for none of the services that we're going to. The team will never ask you for a dime. Everything is free. Everything is covered by your insurance. Okay, so keep that in mind. All right, number 6, the 6th myth that I want to talk about. We're almost done because I have 7 things. So number 6 is that the hospice team will come into my house and take over. False. Hospice does not take over at all. I always tell my patients, whenever I go into a home, I always say to my patients, you are the boss. And I always say to my patients, you are the boss. Okay, and in the family too, I tell them, we, the hospice team, we cannot and we will not do anything without your consent. We cannot do anything without your permission. Okay, whether it is to increase a medication or decrease a medication or take away medication or order supplies, anything at all. And even when we go to a nursing home, we always make it clear to the nursing home staff that if you are used to feeding, Mr. Smith, okay, just because he's on hospice, you're not going to stop, spoon feeding him. Like, hospice is not going to come and take over and do all of the ADLs and things like that. No, because we are symptom management. We manage symptoms. Okay, symptoms. So, but everything else, stays as is. Your life will not change. Whatever it is you were doing, you were used to, we encourage it for you to continue to do it. As long as you have the energy, as long as you're not in pain, as long as you're up to it, by all means, we encourage it. Okay, we're just an added support. We do not take over at all. Okay, and number 7 is, once my loved one dies, the hospice team will abandon me. I will never see the hospice team again. That's a myth. That's false, because we have what we call bereavement services. Okay, bereavement services is up to 13 months, okay, a year after your loved ones die. We provide therapy. Okay, we provide bereavement where you could be part of small groups. You could be part of a spouse who has lost a loved one, or children who has lost a parent. So the social worker will reach out to you and invite and encourage, whether it's the grandkids, whether it's the children, anybody in the family can participate in bereavement. And like I said, it's up to 13 months after the patient has passed. Okay, so these are the 7 myths that I wanted to talk about regarding hospice, regarding end of life care. All right, let me know your thoughts, let me know what you think of. Now, the big announcement that I told you I have a big announcement at the end. The big announcement is, drum roll, yours truly, your sister girl, is in the process, in the middle of writing her own very first book. Yes, she will soon be an author. And my first book, guys, it's going to be about hospice care. Yes, and I'm so excited. It's going to be a blessing to a lot of people. Absolute blessing. Ooh, my eyelash. An absolute blessing to a lot of people, okay? And I'm so thankful and I'm so glad, and I cannot wait for you guys to read my very first book. And I know you're going to support me, and I know it's going to be a blessing, and I really hope that it's going to help to take away some of the myths, take away some of the fear and anxiety behind end of life care. And you guys know my personality, you know, I like to be joyful, I like to be positive. So it's not gonna be a sad book, okay? It's not gonna be sad. It's gonna be very educational, very informative, and real life situations, and it's going to just be a blessing, okay? Because like I said, I don't want us to think about dying as a taboo, because the minute we are born, we are dying, okay? Know this. All right, thank you for watching this video. I love you as always with the love of Jesus Christ. Please subscribe, hit the like button, and comment. See you next time. Mwah. Dance, beautiful people.